Hi, this is Dr. Paul Zeitz. I'm an epidemiologist with a specialty in infectious diseases. I played a prominent role in the global effort to curb the AIDS, TB, and malaria pandemics. Today, we face a critical global health challenge with the COVID-19 pandemic. I'm doing my part by providing reliable answers to your questions and concerns. So the first thing is that we're still in a phase of the epidemic when we're seeing a rapid increase in the number of people getting infected and getting sick and flooding the hospitals. So those epidemic surges that we're seeing in New York and New Jersey and those other cities that I named are going to start happening in other places around the country. So there's sort of mini epidemics happening in different parts of the country all at the same time. So while New York might be plateauing, Baltimore is still on the upswing. When Seattle might be on the downswing, Los Angeles is still on the upswing. So it's a very complex situation where the epidemic might be plateauing or even declining in some parts of the country, and then in other parts of the country it might be still going on. We still have 8 states out of the 50 that haven't implemented any social distancing. And the virus is circulating in those states right now. And so they're likely to have widespread community transmission that will be going on the upswing and being going on for quite some time. So the pathway for us to solve this first wave and prepare for the next phase of this pandemic is to rapidly expand testing. So there's a lot of effort going on right now to expand testing for people to determine if they have the illness. So if you have signs and symptoms of COVID, it's very important to get tested, and it's very important for all of us to advocate for our city, county, state, and federal government to implement a national testing and tracking program. Once we have testing set up and implemented everywhere, it's very important that we identify all the people with COVID infection, we track them down, and we find out who all their contacts are, and those people get isolated. And then we can contain the spread of the virus. So it's called testing, tracing, and containment. That is where we want to get to. But you need to have this national testing program up and running before we can actually effectively implement containment. So there's a lot of advocacy going on right now to get state and city and local health departments to start doing the contact tracing that they've not been able to do so far because of the flood of cases that are occurring. So in this first phase of the pandemic, say from January through April, we were not able to effectively implement this strategy of testing, contact tracing, and containment, and we were in community transmission. Now, with vigorous social distancing that we've been implementing, we're starting to see evidence that the spread of the virus is being interrupted and the human-to-human transmission is declining. And if we're continuing to implement rigorous social distancing for weeks and more, then we can see this curve of new infections really go down. And at the same time that that's happening, we can build up the testing system so that we can implement a more rigorous public health approach where we're testing, tracking, isolating, and we're containing the epidemic in small groups of people. We have to do that in order to contain and prevent community transmission from happening again. The other thing that will be happening as part of a testing and tracking system that needs to be established is that people that have been infected with COVID-19, their bodies have developed antibodies to the virus. And so there will be a blood test where they can give a blood sample. Hopefully it'll be a finger stick eventually, and they can determine whether or not they have antibodies to the virus. That will be really helpful. There's some questions still remaining. It looks like the antibodies are going to be protective, but we don't know for sure whether they give you lifelong protection. or it's a temporary protection. That is still being studied. But assuming that, like other coronaviruses, that you do have some immune response that leads to protection, then we want to know who has those antibodies for several reasons. For one, you would have the peace of mind to know that you've already been infected, you already have antibodies, and so those people could get some kind of certificate and they could then be allowed to relax their social distancing. That will take some time to set up that system. Those tests are being developed very rapidly. They have to be validated, and we have to prove that those antibody tests are accurate. Because the last thing you would want to happen is to have an antibody test that gave you a false positive or a false negative. So it's very important to take the time to develop those tests properly, and then we need to have a national system for distributing those tests. All the reagents, all the inputs into making that test work have to be made available, and then health workers need to be trained, and then people need to know where and how to get them.